will be very heavy consequences. I couldn't present the data, but in France we have an increase in serious diseases like diabetes, like Alzheimer's, like breast cancer, prostate cancer, like autism, which is also very increasing very steeply in UK. So we are going to face huge increase in these incidences and prevalences of these diseases. Presently, we have in France about 5 million people who are affected by these few maladies I just mentioned. So this is data, 5 million, even almost 6 million in 2009. It was in 2000, it was only 2 million. So you see a huge increase within 9 years, even between 2000 and 2009. Now we are going to increase. Indeed, we have recent data showing that, for instance, diabetes is presently affecting 4.5 million people in France. We have presently, like in UK, we have one child born autistic out of 120. So you see these figures are going to just climb up. There is a serious trend for having more problems, health problems, and if we go on this way, we can extrapolate the data we have collected between 2000 and 2009. By 2050, when the children born since 2000 will be in their best years, 1 out in 3 will be diabetic. 1 out in 4 will have Alzheimer's. All men will have prostate cancer, and 1 woman out of 3 will be concerned by breast cancer. And the autistic will be about 1 in 4, 1 in 3 newborns will be autistic. That is the best new world.
How we can stop this trend and how really we can force the industry to switch to progressive methods in science?
We have enough progress recently in science. We can replace the examination of toxic assessment of chemicals, which is the main culprit, by the way, of this increase of incidence and prevalence I just mentioned. We have now methods to see what these chemicals are doing in our body, in our cells, in our organs, and to make a clear cut between what is acceptable, toxicology speaking, and what is not. So we should apply these methods called toxicogenomics, where I will not detail it, but this is a very important step. And presently, in the REACH project, we have the obligation to test in rodents. Sorry, we are not 75 kilogram rats, so to say. And the same holds true for medical progress. Presently, medical progress is tries to make medical progress in animal models. This is nonsense. No species is a model for another species. That's a basic principle for the living systems, you see. So if you take, has been explained, you take monkey as a model for HIV. Chimpanzee is completely immune towards the virus responsible for AIDS. It is barely concerned by hepatitic virus, for instance. Chimpanzees are poorly concerned by that. And if you look at Ebola, chimpanzee is concerned, and we too. So in this simple example, with the best possible model, the chimpanzee, we diverged from chimpanzee about 5 to 6 million years ago. That's nothing. If life appeared on Earth on the 1st of January, we diverged from a chimpanzee 31st of December at 5 or 6 in the evening. So you see that this kind of assessment of, for instance, looking for cure for AIDS in chimpanzee, which are immune to this, is nonsense. I'm sorry to say that.
Sorry, but then why so many scientists still stick to these programs of vivisection?
Okay, there are two main reasons for that. First of all, most scientists have been used to use animal models, and they won't accept to say or to realize that this model is nonsense. They have built their career being professor, doctor, members of the of institutes, etc., on animal model experiments. So they are not right now going to say, okay, I did nonsense. That's evident. Furthermore, you have the industry, the chemical industry, the food and agricultural industry, and now the pharmaceutical industry, which have very high incentive to go on with animal models because they allow them to prove anything and the exact contrary to what's it. If you want to show that a given chemical is carcinogenic, I can choose a strain of mice or rats which is very resistant to carcinogenicity, and your product will be good for the consumer. If, to the contrary, a competitor of you produce the same problem, the same substance, and you want to prove that this product is very dangerous and carcinogenic, I can find you another strain which indeed will show you that this product is very bad. Whether you want
sorry, is it a giant manipulation?
That's a kind of manipulation, yes, you are fully right. And the animal model is what we say in France, pain béni, that is really the best choice for industry because they can prove anything and the contrary and can put on the market the stuff they want, which may be detrimental for the health of the population. And the figures I told you about a few minutes ago, that the incidence and prevalence of these diseases are rising at a very high rate, is just a consequence of the fact that we have in our environment plenty of molecules which are dangerous for our health.
How can we as citizens break this vicious circle and choose for progressive methods that will really cure people from problems and protect us from our dangerous products?
Yes, well, without the public we cannot win. So we have to have people like you and I think a majority of European citizens are interested in their health for themselves, for their children and for grandchildren. As I told you, if we go on this way, it's will be a catastrophe by 2050. So we have to stop that. And the people must be aware that, as a matter of fact, they are manipulated by media, by institutions like this one here, and by, of course, industry, which has plenty of money to pour into this business of make acceptable chemicals which are dangerous for our health. And if the population will not give us a hand to do that, I think the future will be very bad. If I extrapolate the curves of the incidence, the rise of all these diseases I just mentioned, by 2080, 2090, there will be no more human population. We are going to hit the wall. People must realize that this is going to happen, and they must react soon enough to avoid that we are indeed going to hit the iceberg like Titanic